And out front now, Dr. Sanjay Gupta and Dr. Ashish, director of the Harvard Global Health Institute, who testified today before a congressional hearing on the coronavirus crisis. Okay, Sanjay, so President Trump says Fauci's comments on reopening schools were not acceptable. And he specifically said Fauci was playing all sides. I mean, what do you think was happening here? Is Dr. Fauci, was he giving good advice? Were his comments not acceptable in any way? I mean, how are we supposed to read this?
He's been given the same advice all along, Erin. I mean, I think it depends how people want to interpret it at any given time. I think that the idea that there's been specific criteria that have been out there that were released from the White House, and those have been completely abandoned, seemingly. No one's even really talking about those anymore. Instead, people are saying, why don't we have a vaccine by the fall? Why can't schools open? Despite the fact that the specific criteria by which these things might happen have not, the places have not met these criteria yet. It just sort of boggles the mind a little bit, Erin. I also think, Dr. Fauci always chooses his words carefully. He said, I think, with regard to a vaccine by the time schools open, he says, I think that would be a bridge too far. To be clear, he's never suggested that a vaccine might be available by this fall. I think he's, Erin, he's constantly striking this balance between hope and honesty. He doesn't want to jar people, but I think he's been consistent in what he said. So I don't know how it's considered playing both sides of the issue.
And Dr. Jha, the president, questioning Fauci's statements, now also questioning whether deaths are being overstated. And of course, we played Dr. Fauci clearly saying that it is correct, that the number is likely higher. It is almost certainly higher. So how concerning is this? You've got that's a pretty crucial thing to now the president go on the other side of.
Yeah, so Dr. Fauci has a long track record of speaking truth and speaking the best scientific evidence. And sometimes people love it because he says what they want to hear. And sometimes they don't love it because he's saying things they don't want to hear. But what makes him so incredibly valuable to the American people is that they know they can trust what he's saying and he's giving it to them straight. And that's what he did yesterday. And I know that some people didn't love his comments, but he's representing the best science and data and evidence we have right now. And he's right on all of those counts.
So, Sanjay, when Fauci has said directly, it's almost certainly higher. And President Trump is saying that he's now questioning, as we understand, that deaths are being overcounted. Is there any possibility that Trump's theory is right?
I don't think so. I mean, I think, the thing about the nature of these sorts of things is that these are confirmed infections and confirmed deaths. We know that there was inadequate testing early on. There was probably people who were dying of respiratory illnesses that were thought to be flu or something like that early on that were most likely or more likely coronavirus. We know that there was this Yale study that suggested that maybe there were 15,000 more people who had died of coronavirus than were officially counted. This is sort of the nature of an early illness. We tend to undercount, not overcount. I'm not sure that it matters that much, Erin. I'm not sure what the real context here is. A lot of people have died. It may be 15, 20,000 more. I mean, these are all tragic figures, no matter how you look at it. The fact that people are now saying, well, maybe it's a few thousand less, a few thousand more. I'm not sure what the real value of this is. The thing that strikes me, Erin, is that, and Ashish may agree with this as well, but as doctors, you always try and take care of your patients. If your patient has a disease or an infection, in this case, you recommend a course of therapy. The patient doesn't take the course of therapy and then complains that they're not getting better. What is the doctor left to do? Take the therapy. This can help you. This can help get you through your illness.
Right.
That's sort of the position the country is in right now, it seems.
So Dr. Jha, Trump again claimed tonight that we have more tests and better tests than the rest of the world. You are the testing expert. You testified at the congressional hearing today about testing. So when he says, as he oft does, we have more tests and better tests than the rest of the world, is he right?
Well, I don't know what better tests are. I mean, we have pretty good tests, but so do lots of other people. I don't know that our tests are any better. On the issue of whether we have more tests, the fundamental question is, do we have the amount of tests we need for the size of the outbreak we have? And the answer is no. I don't know a single public health person who disagrees with me. And if there is some scientific fact that I've missed or all the other experts have missed, I'd love to hear it from the president or any of his supporters. But the bottom line is that this is not a competition with do we have more tests than the Italians or the Germans. This is really an issue of do we have the number of tests we need to make Americans feel safe, so when they go back to the office, when they go back to a coffee shop, when they go send their kids to school, they can feel comfortable that people are not infected and spreading the disease. And the short and long answer is no. We don't have that number of tests, and that's what all of us are calling for.
And yet, Sanjay, states are opening, people are going out. And we know there's a lag here in terms of how, right, it takes a week or two before infections show up. So we don't know what's going to happen in a week or two. I will say across the country, though, when you look across the country, there are some bright spots. You've got 9 states where cases are going up, but you have 22 where cases are going down. 19 are still on that plateau. So when you take those numbers, and obviously there's plenty in there to say, okay, cautiously optimistic, but then you have all these states opening. Do you see all this as good news that will last?
I think some of this is good news. I mean, certainly seeing numbers go down is going to be good news. I think that the gating criteria, and this is just coming back to the numbers and the facts. I'd love to see those numbers go down for 14 days in a row. There's a reason for that. Once you feel like you've gone down that number of days, then inevitably, Erin, as you know, there's going to be people who become infected as we start to become more mobile. But the idea that as Dr. Jha was talking about, we have testing. It's going to be a small enough number where you can find those people who are newly infected, you can isolate them, and you can trace their contacts. The reason that you're doing that is because there's going to be new infections. You want to prevent that from turning into exponential growth. So it's great news that the numbers are coming down in some places. It has to be sustained, and it has to be able to be managed so those small numbers of infections, hopefully in those places, don't start to spike.
All right, Sanjay, thanks. Dr. Jha, Dr. Gupta, thank you both very much.